Hi, welcome back. This is Dr. Catch at Dr. Catch Medical and Life. Today I'm going to run over a CAT scan finding of a kidney tumor. So the patient was having pain, lower back pain actually, and sought help from his primary care doctor. And an MRI was done to look at the back just to see see if there was any problem with the spine. The spine looked okay. However, there was some significant finding on the MRI, which is not very clear. So a CAT scan was done to further evaluate on the findings on the kidneys. And CAT scan is a good modality to look into the abdominal region, looking at the internal organs and such. And so, just for perspective, this is a picture where you start cut right in the upper abdomen, uh, cutting through top and bottom of a person. And black is air, that's lungs on both sides. This is the right lung, left lung, that's the kidneys, stomach, heart area is going to be over here, the spleen over here. And then as we move down, you will see a whole bunch of bowels. And along the way, you will then see the kidneys, okay? So let's go ahead and go down here. This is the right side, just for orientation, right side, left side. This is the top of the liver right here. And we'll be traveling down, spleen over there, traveling down. This is the spine, big blood vessel here, muscle, these are just the fatty tissue. All of us have that, of course. And as we travel down here, again, this is the liver right here. Liver, spleen, gallbladder. This is the gallbladder, sits under the liver here. And we will be coming down to the top of the kidneys, okay? These spots right here. Left kidney, right kidney. So we'll be traveling down here, left, right. Notice the contour of the kidneys, nice and smooth for now at this view. Again, liver and gallbladder right there, okay? And then we move down, still nice and smooth edges over here. As you can see, nice and smooth, left kidney, right kidney. And then you will see that as we move further down, you see this is continuing to be nice and smooth and round. But here you see that there's something growing around this region. So focus on this region right here. And again, nice and smooth edge. But here you see that it's bulging in this area right here, okay? Bulging, growing, bursting in this region right here, not normal. This is more normal down here with the edges nice and smooth, but up here you see this outburst growth of some kind, replacing all the kidneys, normal kidney tissue in this whole area right here. And again, this is the normal side right here. That's not normal right here, okay? All right, so going down towards the pelvis down there. These are intestine. That's air in the intestines, all the way down to the bladder right here. So just for orientation, we'll go up again, bladder right there, and then start seeing the kidneys. Okay? All right, start seeing the kidney. Left side, right side, not normal. Normal right here, not normal on the top. Okay, and then going up into the liver, gallbladder, and up into the lungs. Air is black, so you start seeing black right here, black right there. Just want to show you something in the lung. There's actually a spot in the lungs already, and just for a little, let's lung. So this is a spot that it's a nodule in the lungs already. Okay, a lot of these are blood vessels. Okay, and if you're trained radiologies or you're trained looking at CT scan, you know that these are arteries, blood vessels, and but this is an isolated nodule by itself over here. Okay, these you can actually trace where they go, and they'll start out bigger up here and going smaller, so you know they're not mass, they're not nodules. But this is an isolated mass right here. So whatever's happening in the kidneys has already spread into the lung, unfortunately, and still being worked up to see exactly what it is. Most likely it is a tumor that has spread already, and if the kidneys, for a particular kind of kidney cancer, certain type of cancer, you want to get a biopsy of the tumor. But for a certain kind of kidney tumors or mass, you don't want to do that because you can seed it into uninvolved areas, so you just want to remove it. But since it's already seems to have spread into the lungs already, most likely the patient will need to have the right kidneys removed, and then with confirmation, and then start treatments with chemotherapy, radiation, whatnot is appropriate. Okay, so just thought I'd share this with you, and this definitely bad news for the patient, but with care from a specialty team, hopefully the patient will recover. We'll have to wait and see. All right, take care. Bye. Thanks for joining.